You've heard about dry eyes and dry mouth. But what if the real danger of Sjogrens is the 10 symptoms your doctor has never connected to it? In America, Sjogrens affects nearly 4 million people, predominantly women. Beyond signature sicca dryness, U.S. clinical focus increasingly targets systemic red flags, like debilitating fatigue and small fiber neuropathy. Diagnosis remains challenging, often requiring years to distinguish these multifaceted autoimmune symptoms from menopause, fibromyalgia, or chronic fatigue syndrome. By the end of this video, you'll know the 10 hidden symptoms that are sending people to the wrong doctors for years, and what they actually mean. Welcome to Healthcare Unmasked, where we break down complex medical conditions into clear, simple information. Love diving deep into health insights like these? Subscribe now to join our community. We're on a mission to hit our next big milestone, and your support helps us keep bringing you the facts that matter. Tap that button and stay informed. Most of Sjogren's content, online and in clinics, stops at dry eyes and dry mouth. But doctors frequently mistake it for fibromyalgia, IBS, or functional neurological disorder, sometimes for decades, because clinicians default to these labels when they lack an obvious explanation for scattered, multi-system symptoms. Your body was warning them all along. These are the 10 symptoms that don't make the pamphlets, but absolutely should. Symptom 1. Trigeminal neuralgia. The condition nicknamed the suicide disease, and Sjogren's may be the reason you have it. One light touch to your cheek, a single bite of food, a mild breeze on your face. Suddenly, an electric, white-hot stabbing pain that lasts seconds but feels like an eternity. Patients describe it as the worst pain of their lives. Most spend years in dental chairs, pulling perfectly healthy teeth, convinced the problem is their jaw. It never was. Here is what is actually happening. Sjogren's immune cells directly infiltrate and inflame the trigeminal nerve, the largest cranial nerve in your face, responsible for all facial sensation. Trigeminal neuralgia and facial neuropathy are among the most documented nerve complications in Sjogren's, with a reported prevalence ranging from 12 to 50% across studies. That is not a rare complication. That is nearly half of patients. Yet the referral chain sends them to dentists, then ENTs, then neurologists. Every specialist except the one who could actually connect the dots. The autoimmune cause sits undetected. The pain keeps coming back. Symptom 2. Dysautonomia. Your body's autopilot, completely breaking down. And Sjogren's is pulling the controls. You stand up, and the room tilts. Your heart races for no reason. You're sweating when you shouldn't be, freezing when you should be fine. Orthostatic intolerance, racing heart, brain fog, and extreme fatigue after the smallest activity. These are the calling cards of a malfunctioning autonomic nervous system. Most patients spend years chasing cardiologists and psychiatrists. Nobody checks for autoimmune disease. Here's what's actually happening. Sjogren's is the second most common cause of autonomic neuropathy, right after diabetes. The immune system targets the nerves controlling your heart rate, blood pressure, digestion, and temperature regulation, all at once. In a large registry study, nearly 55% of Sjogren's patients scored high enough on autonomic testing to confirm clinical dysfunction. And the most alarming part? Despite how widespread it is, dysautonomia in Sjogren's remains formally excluded from classification guidelines, meaning most rheumatologists aren't even trained to look for it. Your nervous system was failing. Your doctors called it anxiety. Before we dive in, thousands of Sjogren's patients are sitting in doctor offices right now, unable to explain what their body has been doing for months. No record, no pattern, no proof, just dismissed, again. Without documentation, symptoms get forgotten, appointments get wasted, and diagnoses get delayed by years. Patterns that could have changed everything, gone forever. That silence costs you time you cannot get back. Our finally heard symptom tracker changes that completely. 30 days of organized, doctor-ready evidence, tracking every flare, every pattern, every body system covered in this video. You walk in prepared. You get taken seriously. You get referred faster. You get answers sooner. A limited time discount is running right now. Link is pinned below. Grab it before we begin. Symptom 3. Small fiber neuropathy. 3 words your neurologist probably never connected to Sjogren's, but should have. Imagine your feet are on fire at midnight. Burning, electric shocks, pins and needles. But nothing you can see explains it. Patients report burning pain, numbness, tingling, pins and needles, electric discharges, and extreme sensitivity to touch. Doctors dismiss it as anxiety, stress, getting older. They're wrong. Here's what's actually happening inside your body. Small fiber neuropathy cannot be detected by standard nerve conduction studies, making it an elusive and frequently overlooked condition. The immune system is silently destroying the tiniest nerve fibers woven through your skin. The test most doctors run, it misses them completely. A skin biopsy measuring intraepidermal nerve fiber density is the only reliable way to catch the damage. And here's the part nobody tells you. Nearly half of Sjogren's patients with this neuropathy experienced nerve pain before they ever developed dry eyes or dry mouth. Their bodies were screaming. Nobody listened. Symptom 4. Aphasia or brain fog. Word loss, mental short circuits. The symptom everyone dismisses because nothing shows up on the scan. You are mid-sentence, and the word just vanishes. A simple word, a word you have used 1,000 times. Gone. You lose your train of thought in a conversation you started. You read the same paragraph 4 times and retain nothing. Doctors tell you it is stress. Your family thinks you are distracted. You start wondering if something far worse is happening to your mind. Here is the reality. 80% of Sjogren's patients experience measurable cognitive dysfunction. Not imagined, not emotional, not age-related. Neuroinflammation caused by Sjogren's directly disrupts signaling pathways in the regions of the brain responsible for language retrieval, working memory, and information processing. The immune system crosses the blood-brain barrier and creates damage that standard MRI scans frequently miss entirely. This is not burnout. This is not depression. This is autoimmune neurological inflammation, and it has a name. Yet the average patient waits years before anyone orders the right test. Symptom 5. Raynaud's phenomenon. Your fingers turn white, then blue, then red, and everyone tells you to just wear warmer gloves. The air conditioning kicks on. Mild stress hits. You reach into the freezer. Within seconds, your fingers drain off all color, ghostly white, then a deep, alarming blue, then a painful burning red as blood rushes back in. Numbness, throbbing. Sometimes the pain is intense enough to stop you mid-task. Most people laugh it off as a circulation quirk. Their doctors agree. Nobody asks why it is happening. Here is what is actually happening beneath the skin. Sjogren's triggers abnormal immune signaling that causes blood vessels in the extremities to overreact violently to cold or emotional stress, cutting off circulation entirely. Raynaud's affects between 10 and 30% of Sjogren's patients and is a direct marker of systemic vascular inflammation, not a harmless sensitivity. The dangerous part? Raynaud's almost always gets diagnosed as a standalone condition. The autoimmune investigation stops there. The Sjogren's driving it underneath goes completely undetected, sometimes for a decade. Your blood vessels were sending distress signals. Nobody decoded them. Symptom 6. Palpable purpura, vasculitis. Small spots on your skin that look harmless, but internally, they are one of the most serious warning signs Sjogren's can produce. You notice small raised purple or red spots clustering on your lower legs. They do not itch. They do not fade when you press them. They just sit there, painless, persistent, and easy to ignore. Most patients get told it is a rash, an allergic reaction, dry skin. They are handed a topical cream and sent home. The real cause walks out the door with them. Here is what those spots are actually telling you. Sjogren's immune complexes are depositing inside the walls of your smallest blood vessels, causing them to inflame, rupture, and leak blood beneath the skin. That is not a rash. That is vasculitis. Cutaneous vasculitis occurs in approximately 10% of Sjogren's patients, and critically, it carries a documented association with elevated lymphoma risk. Your skin became a window into a much deeper systemic crisis. The spot is not the problem. The spot is the messenger. Ignore the messenger long enough, and the message becomes catastrophic. Symptom 7. Interstitial lung disease, ILD. A slow, silent destruction happening inside your chest, while every cough gets blamed on allergies. It starts as a dry, nagging cough that never produces anything. No phlegm, no relief, just a persistent, irritating tickle that follows you everywhere. Then climbing one flight of stairs leaves you breathless. Walking to your car becomes an effort. And sometimes, deep in your chest when you inhale fully, a faint crackling sensation. Like Velcro slowly pulling apart. Patients describe it for years before anyone takes it seriously. Here is what is happening inside those lungs. Sjogren's sends immune cells flooding into lung tissue, triggering lymphocytic alveolitis, interstitial pneumonitis, and eventually irreversible fibrosis. Healthy, elastic lung tissue gets systematically replaced by rigid scar tissue that cannot expand, cannot transfer oxygen, cannot recover. The damage accumulates silently over years before symptoms become undeniable. Most patients cycle through pulmonologist after pulmonologist. Inhalers get prescribed, allergy panels get ordered, nobody runs an autoimmune panel. By the time fibrosis is confirmed, some of that damage is permanent. Symptom 8. Interstitial cystitis, painful bladder syndrome, the infection that never was, and the autoimmune attack nobody diagnosed. The urge hits constantly. Urgent, relentless, impossible to ignore. Pelvic pressure that burns and aches, like a textbook urinary tract infection. You go to urgent care. They test your urine. Negative. No bacteria. No infection. They send you home with a shrug. It comes back next week. And the week after. Some patients make this same trip dozens of times across multiple years. Each time leaving, with no answers and no relief. Here is the mechanism nobody explains. Sjogrens targets moisture-producing and membrane-lining tissues throughout the entire body, not just eyes and mouth. The bladder lining becomes infiltrated by the same lymphocytic immune cells, attacking your salivary and lacrimal glands. The result is chronic inflammation of the bladder wall that produces every symptom of a urinary infection, without a single bacterium present. Same immune process, different organ. Completely missed connection. Patients spend years rotating through urologists, gynecologists, and pain specialists. The autoimmune workup never gets ordered. The bladder was never infected. It was under attack. Symptom 9. Livedo reticularis, a lace-like map drawn across your skin in purple and blue, and almost every doctor reads it wrong. You notice it first on your thighs. A web-like mottled pattern, purple, bluish, almost marbled, spreading across the skin in irregular rings and branching lines. It deepens when you are cold. It fades slightly when you warm up. It is painless. It does not itch. It does not blister. So patients photograph it, show their doctors, and hear the same response repeatedly. Poor circulation, cold sensitivity, completely harmless. They leave reassured. They should not be. Here is what that pattern is actually mapping. Sjogrens drives chronic vascular inflammation that impairs blood flow through the smallest vessels, sitting just beneath the skin surface. Blood pools irregularly in the surrounding capillary network, creating that distinctive lace-like discoloration visible from the outside. This is not a cosmetic quirk. It is a cutaneous signal of systemic autoimmune vascular involvement happening in real time. The pattern on your skin is a direct reflection of inflammation running through your vessel walls. Your body drew the diagnosis in plain sight. Nobody looked closely enough. Symptom 10. Gastroparesis. Your stomach has stopped doing its job, and Sjogrens quietly cut the wires controlling it. 3 bites into a meal, and you are done. Painfully, uncomfortably full, as if you just finished a feast. Nausea that lingers for hours after eating. Bloating that never fully resolves. Food that sits in your stomach like a stone, refusing to move. You stop enjoying meals. You start avoiding them. Your weight drops. Your energy craters. Doctors run scope after scope and find nothing structurally wrong. They label it IBS, then GERD, then functional dyspepsia, then anxiety around food. Here is the mechanism behind every miserable meal. Sjogren's autonomic nerve damage directly disrupts the vagus nerve, the primary nerve commanding your stomach to contract, churn, and empty. Without proper signaling, stomach motility slows to a crawl. Food ferments rather than digests. Gastric emptying becomes dangerously delayed. This is not a digestive sensitivity. This is neurological damage to the command system of your entire gastrointestinal tract. The stomach did not fail randomly. The immune system methodically destroyed its instructions. Every dismissed meal was a symptom waiting to be connected. Here is what ties all 10 together, and why ignoring them could cost you everything. Every symptom on this list represents active organ-level inflammation. Left unaddressed, that inflammation progresses into lung fibrosis, kidney failure, or lymphoma. Sjogren's patients carry a documented elevated lymphoma risk, frequently linked to the very skin vasculitis covered in this video. Early diagnosis is not optional. Your body has been asking for the right doctor all along. If you experience rapidly spreading numbness, sudden vision loss, or acute shortness of breath, go to the ER immediately. Do not wait for a scheduled appointment. This video is for educational purposes only and does not constitute medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider regarding your symptoms. Before we close, thousands of Sjogren's patients are sitting in doctor offices right now, unable to explain what their body has been doing for months. No record, no pattern, no proof, just dismissed. Again. Without documentation, symptoms get forgotten, appointments get wasted, and diagnoses get delayed by years. Patterns that could have changed everything. gone forever. That silence costs you time you cannot get back. Our Finally Heard symptom tracker changes that completely. 30 days of organized, doctor-ready evidence, tracking every flare, every pattern, every body system covered in this video. You walk in prepared. You get taken seriously. You get referred faster. You get answers sooner. A limited time discount is running right now. Link is pinned below. If this video opened your eyes to symptoms you didn't know were connected, subscribe to Healthcare Unmasked and join our community. The link is pinned in the comments below.